Policy Committee will come to order. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett. Carter.
Present.
Hatzma.
Present.
Neely. Here. Glanville.
Present.
Kafia.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingans.
Here.
Vanderwall.
On Zoom.
Filler.
Yes.
Mueller.
Here.
Van Werkum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Here.
And Madam Clerk, I believe Rep. Whitsett might be on Zoom too. Rep. Whitsett, are you there? Okay, thank you.
You have 18 members present. You do have a quorum.
Thank you. Representative Glanville moves to approve the minutes from our meeting on March 23rd. Seeing no objection, the minutes are approved. Today we will be hearing testimony on the Filter First package, House Bills 4340, 4341, and 4342. We will be hearing testimony from the bill sponsors, including Representative Puri, Vice Chair Vanderwall, and Representative Neely. Following that, we will take testimony from Rebecca Lazarus, former president and treasurer of Ann Arbor Public School Board of Education, who will provide her perspective on the experience of installing filters in our schools. Abby Dumas, a parent impacted by lead in the water supply. Ellen Warren-Betanzo, the founder of Safe Water Engineering, to talk about water testing, and Cindy Roper of the Natural Resources Defense Council, who will provide an environmental perspective as well as speak to their cost effectiveness. Lead exposure is a significant concern in my district. With an aging housing stock and infrastructure, we have far too many children testing positive for lead poisoning. This remains a personal priority of mine, and I look forward to hearing testimony today. And with that, I welcome Representative Puri forward. Thank you for bringing these important bills to our committee, and come on forward and begin when you are ready.
Thank you, Chair, and good morning, everyone. Thank you again, Chair, and the members of the committee here for allowing me to have this opportunity to testify before all of you today. I am both proud and excited to be here, and I'd like to start out by recognizing the immense amount of time and dedication that was put into these bills, which started years ago. I want to thank all of the dedicated stakeholders and legislators who worked on this legislation last session and sessions before. It's because of this work that we're here today. It's been almost a decade since the Flint water crisis, and our state still has no law or regulation to stop lead contamination of a school's drinking water. Safe drinking water, especially for children and other vulnerable communities, is a bipartisan issue. It's not a political issue. It's a public health issue. It's an environmental issue, and it's an equity issue. It's an issue that deserves our immediate attention. And so this package of bills, which I'm a proud sponsor of, would ensure that schools and daycares assess water quality and create safe drinking water plans with the guidance from EGLE. It would follow a phase-in period for schools and daycares, which would be required to install filtered drinking water outlets and on-tap filters to ensure non-filter outlets are removed or not used. It would require schools and daycares to test their water annually and replace filters as needed. And it would create a fund within EGLE for the department to make grants to all public schools as well as child care centers. Now, last term, the legislature appropriated $50 million in filtration systems, but this legislation is necessary to effectively implement that program. So we know that there's no level of lead exposure that's safe for children. And you will hear, and I know that you will hear more today about the effects of lead exposure from other experts. But Michigan's kids need clean, fresh water to stay healthy and strong. Limiting exposure to lead will help children avoid health problems, stay in school, and grow up with more opportunities. And as the proud father to 3 small boys, this is the least I can ask for any parent. And I think, and I can speak on behalf of all parents and Michiganders, that the place that we send our children every day to learn, to make sure that it is safe and has clean drinking water. So Filter First is a clear pathway to a healthier future for Michigan's youngest residents. And so thank you again for allowing me to testify, and to the chair for acting swiftly on this legislation. I will yield the rest of my time to the other sponsors and speakers lined up today. Thank you.
Thank you. And I know Rep. Puri has another engagement to run to, so we appreciate your time, and we're going to move along to Vice Chair Vanderwall. Thank you for joining us remotely, Vice Chair Vanderwall, and I know you have some other obligations at the moment. A huge thanks for your hard work for past years of and past sessions of work on this. Your advocacy on this issue has really helped pave the way so that we can move these bills to ensure our children at school and while in childcare settings have access to clean and healthy water. If you could share your perspective on some of the history of the bills and the work that has gone into getting them here today, that would be appreciated.
Well, thank you very much, Madam Chair, and I appreciate the opportunity to come in at Zoom. So everybody, I apologize I'm not there in person. However, I'm going to divert real quickly. My wife had a complete knee replacement done yesterday, and we had truly just a great experience. I mean, for a major surgery like that, she was up and walking within 5 hours. She's home and doing very well. So I apologize I can't be there, but a true factor of how a great medical system and the doctors that we have in this nation can provide a great service. But getting back to the bills at hand, it's been 4 years that we've worked on these bills. It originally was introduced in the Senate 4 years ago. Senator Ananek and I put these filter first bills, and it really came from a meeting that I had in Chicago with the Great Lakes Water Caucus, and really what we can do to ensure that our children, both in daycare settings and in our school settings, especially in the older facilities, we could assure that the water was of a good standard. We know that children have, they absorb lead at a greater rate. It does affect their learning opportunities, and then the long-term health aspect. So this is really where it came about. We've worked 4 years on making sure that we really worked through all the bugs, and we almost got it to the finish line last year. And of course, we ran out of time, unfortunately. But as the other representatives and I have continued to work, we're pleased to bring this forth. You're going to have some really good testimony coming up from the experts. I'm here to answer any questions, but the biggest part is just making sure that everybody understands this will, it's not a forced mandate in our school systems. This is the opportunity at schools that have some older plumbing, could make sure that the water that's available for kids in drinking fountains or in the cooking is filtered first, and the same thing in our daycare. This won't shut any schools down or shut any daycares down, but it will ensure that our children have good, clean, lead-free water to drink, and real proud to be a part of this package. So again, thank you everybody for the opportunity, and look forward to listening to the testimony. And again, thank you, Madam Chair, for allowing me to testify via Zoom.
Vice Chair Vanderwall, you have a Class A excuse, and you are excused from not being here because of that important job. And I hope you make your wife's knee bend really far today. Do any members have questions for Vice Chair Vanderwall? I see Representative Roth.
Thank you, Madam Chair. And now he goes off screen. He doesn't want to answer my question. Probably Diane hit him. Oh, there he is. Representative, thank you. I just a little bit of a clarification on the child care. I see it's written centers. Is there a size or a description of the child care's facilities that we're talking about here? I mean, I don't mind testing all of them. We should all have good drinking water, but if we have a daycare, say in northern Michigan, where the water is fabulous in that area, and they test it and it's good, do we still need to be filtered at that point? What's the size we're talking about?
Really, hopefully I'm on. Really, it doesn't matter the size. If their water tests and it's clean, then there's not an issue. This is just an opportunity for some of these daycare facilities that could be in older settings to make sure that they have a filter. And it can be an outside filter that's even, on the faucet itself. So it doesn't force anybody to do this, Representative. It's just if they're having an issue and there's a slight detection, they can jump on and access this program.
I thank you for the clarification. Thank you, Madam Chair.
Any other questions? Seeing none, thank you so much, Vice Chair Vanderwall. Next up, we have Representative Neely. Thank you so much for joining us to talk about these important bills, and I know it is of personal interest to you and your constituents as well. Welcome. Begin when you're ready.
Good morning, Chair Rogers. Thank you for the opportunity to speak this morning about this very important subject, especially for my community in the city of Flint. Everybody know that we went through a big deal with water. And so this bill is just really simple. It's just a guideline to make sure with all the other bills that we're posting and letting parents know when we're testing and replacing the filters. Pretty simple, and that's about it for this bill. It's just that simple. And like I say, it's very important to me because of the things that we went through in the city of Flint, and I would hate for any community to have to go through what we went through. So it's important that we keep our children safe. Right now, we're still testing our kids from lead poisoning from what we did almost 7-8 years ago. So it is very important that these bills get passed, and I hope today that my colleagues will be a part of this with me and make sure we get this through. Thank you.
Are there any questions? I see Representative Glanville.
Thank you, Madam Chair. Just a quick question about, so the posting, is there going to be signage around water as well? I'm curious particularly about outside water sources. So there might be a spigot on the outside of a building.
Yes, there will be signage to let you know that it's for human consumption, and it'll be also letting you know if it's filtered or unfiltered.
Okay. And it's on the interior and exterior?
Yes.
Okay, thanks.
Thank you. Any other questions? Thank you, Representative Neely.
Thank you.
Next up, we have someone to testify about the experience of schools with installing these filters and the impact it has on students. Rebecca Lazarus, if you could come up on the Zoom and share your background and perspective on these bills. Please go ahead and welcome. Thank you.
Good morning. Good morning, Chair Roberts and committee members. My name is Rebecca Lazarus. I'm the former president of the Ann Arbor Public School Board of Education and proud parent of 2 public school children. I'm here to testify in support of HB 4340, 4341, and 4342. These bills will be crucial guidance and necessary funding to install state-of-the-art filtered drinking water stations in all Michigan public schools and child care facilities. This will ensure that over 1.5 million children in our great state will have access to safe drinking water. Access to safe drinking water is a basic human need, and as caretakers of children, we must make sure that every child has the ability and opportunity to build a bright future and develop physically, cognitively, and emotionally in healthy learning environments. Students in Michigan spend on average 35 hours per week in our school buildings, while a large percentage of these very same children spend an additional 10 to 15 hours per week in before and after care child care facilities. In 2016, Ann Arbor Public Schools proactively tested and sampled various water sources in 17 of our 32 schools, old and new. Unfortunately, we found lead in every one of them. We immediately reached out to industry experts to help guide us through the remediation process, but we quickly discovered that guidance, even among professionals, was inconsistent and proposed solutions that were extremely expensive. We also found that experts differed on what was an actionable level of lead in drinking water. Some said 15 parts per billion, others said 10, and some said 5. There was no consensus. But we knew there was no way to remove lead once it enters the body of our children. oops, sorry. Educators and health experts did agree that any amount of lead ingested by young children and teens can be dangerous and can cause lifelong serious mental health problems. Removing old pipes, plumbing pipes and fixtures from our aging buildings was not a financially feasible solution. And the only financially responsible solution was to install water filters and signs on all of our 1,426 drinking sources. In 2019, the board approved the implementation of Filter First, and the plan worked and continues to work today. In hindsight, it would have been extremely helpful if we would have had these built in place to guide us through the remediation process, thereby saving the district valuable time and money. Michigan is only one of 12 states in the US that provide no funding to schools for building construction and maintenance needs. But fortunately in Ann Arbor, we have a supportive community that is willing to support a major capital improvement bond and sinking fund. These funding mechanisms allowed our district to implement the Filter First plan. Many school districts and child care centers do not have this ability to levy taxes or issue bonds. So this is why it is imperative to properly fund these bills for successful implementation and to cover ongoing expenses. I please encourage you and your colleagues to vote yes on these three bills. Thank you.
Thank you. Do we have any questions for, I see Representative Roth.
Thank you for the testimony. I appreciate it. Thank you, Madam Chair. Approximately how much would it cost the school district to test the water facilities that kids would drink out of Ann Arbor?
When we were doing it back, we have so many, so we were able to get the economy of scales. It costs us, depending on the sampling and the size and when, it was anywhere between $80 to $110 per sample.
Okay. Appreciate that. Thank you, Madam Chair.
Thank you. Any other questions? Thank you so much. Seeing none, we will move on to speak from the perspective of why access to safe and clean water is vital for children. We have a parent, Abby Dumas. Ms. Dumas, if you could please share your experience with the committee, we would be grateful.
I don't think Abby is available until a little after 11. And so if it doesn't work to keep her in the queue for a little bit later, then understand that.
Okay, thank you. We will move along. As we have heard previously, these bills require the testing of water in schools and child care centers. And to speak about the process of water testing, we have Warren Batanzo, founder of the Safe Water Engineering. Welcome and begin when you are ready. Thank you.
Good morning.
Good morning.
Thank you, Madam Chair. I have some slides that I provided to support my presentation. Thank you. So we're talking about this approach to filtering first for drinking water in schools because we do have lead in most of our plumbing. Even the current definition of lead-free plumbing by definition, has up to 0.25% lead by weight. And so when we have lead in our plumbing and the water passes through that plumbing, it'll pick up that lead. And that's why we're filtering at the outlet before a student takes a drink. So looking at water data for our schools, I didn't have to go very far to find lead sampling that had elevated lead in the water. This is data collected in my children's elementary school back in 2016, voluntary lead sampling. And so we heard before how there are different action levels around lead in drinking water. The American Academy of Pediatrics recommends 1 part per billion as an action level. So what we found is most of the classrooms in my children's elementary school had greater than 1 part per billion of lead in the water. We also know that lead release in water is sporadic. These are 3 samples collected in the same classroom. The first sample was 6.3 parts per billion. The second sample was 140 parts per billion. So according to some metrics, that first sample might have been considered safe if you were using EPA's action level of 15 parts per billion, but 140 parts per billion is definitely not safe and definitely not anything we want our children drinking. So they did remediation. They replaced with a brand new faucet, and they sampled the new faucet, and it came out at 3.5 parts per billion. So still not where we want it, meeting the American Academy of Pediatrics action level of 1 part per billion. So even replacing the faucets doesn't guarantee us that we'll get to where we are. So that's why we want to use this filter first process that we have in the bills that we're considering today. So here is just another example of data from my children's elementary school where the first samples, most of them were okay, but repeat samples, some were higher, some were lower. We keep getting different levels, and a child could be drinking any one of those glasses of water. We want children to be drinking water that's non-detect for lead. So more recent data, there's been some voluntary sampling across the state of Michigan. So I got some data via FOIA request that's been voluntarily collected from 2020 through 2022. And looking at that data, from the schools that sampled, 71% of schools in Michigan had samples with lead in their water greater than 5 parts per billion, and 58% of the schools that sampled had lead in their water over 15 parts per billion. One of those schools is Everett High School in Lansing, and we have a group of high school students here today who have been looking at that data, and they're concerned about the water in their school. They want to make sure that they have safe drinking water in their school. And so in this graph, I've compared this occurrence rate of lead to a national study looking at other states. And so this voluntary sampling in Michigan is really on the high end compared to other states of how many schools are finding lead present in their drinking water. And so if you extrapolate the rates of finding lead in schools from the small number of schools that did the voluntary sampling, if you extrapolate that to the total number of schools in Michigan, we'd estimate that over 1,900 Michigan schools might find lead over 15 parts per billion, 2,400 schools might have lead over 5 parts per billion, and over 3,000 schools might be finding lead over 1 part per billion, that American Academy of Pediatrics recommended action level. Luckily, in my children's elementary school in the Birmingham public school system, they adopted the filter first approach back in 2019 and 2020, and they installed filter stations. And every sample that they have collected for drinking water since then has been below 1 part per billion, non-detectable for lead. So this is evidence that this approach works and will improve drinking water for over 3,000 public schools in Michigan.
Congratulations, that's amazing data, and thank you for your testimony. Are there any questions? I see Representative Conlon.
Yes, thank you, Madam Chair, and thank you for your testimony. I suppose these numbers are incredibly alarming, and the question is, do we know how our children have been affected by these numbers to date?
There is some lead sampling in children. There are limitations to that data. And when we do sample children for lead exposure, that you can only detect their total lead exposure. There's no way to tease out what portion of their lead exposure is from school drinking water versus other sources. But we know lead is cumulative, and so when we have an opportunity to address any one of those sources, we can bring it down and have an improvement in health for children.
I can also touch on that as a healthcare provider myself. So we know that especially children from 0 to 6 years old, their brains are, of course, our brains are developing all the way up until age 21, but you have a critical time period in the 0 to 6 year olds. And so that I'm really glad that in this package, the child care centers are also included as well as the schools. But every child has different exposure and different needs and different impairments, I will use the word, so that it's not like a one-size-fits-all approach. And I've seen balance problems in people. I've also seen, I think some of our children's aggression can be tied and linked to lead exposure. So, any other questions? Representative Hadsma.
Thank you, Chair. Ms. Batanzo, thanks for identifying Beverly School as in the Birmingham district, and thanks for also talking about, or someone previously talking about issues in Lansing Everett High School. Where are these 1967 schools principally localized, if you know?
So that was an extrapolation from the voluntary sampling data if the same rates apply for schools statewide. And as I've mapped out the schools that have participated in voluntary sampling, they're all over the state. It's not localized in one area, it's all across the state. So this is benefiting students statewide.
Thank you.
Any other questions? Thank you for your testimony. Next, joining us from the Natural Resources Defense Council and to speak about the cost effectiveness as well as environmental impact of our bills, we have Cindy Roper. Cindy, welcome, and begin when you are ready. Thank you.
Thank you so much, Madam Chair and members of the committee, for the opportunity to be here today. As noted, I'm here on behalf of the Natural Resources Defense Council to support these three bills. And we have a long history of working to eliminate lead from drinking water all across the country and in Michigan as well. I included in my written testimony information that goes along with what Elin Betanzo presented with regards to if you look for lead, you will find it. And I won't repeat that information, but based on our experience in New York State, which was the first state to start a comprehensive testing program, the results of their testing are in my written testimony, and based on that, we decided that it made a lot of sense to just skip the whole testing piece of it and go straight to filtration, again, for the reasons that have previously been noted about lead even being in new plumbing products and fixtures, the inability for school districts to afford to rip out all of the plumbing and then reintroduce more lead into the system. And so the Filter First bills were sort of born out of some model legislation that NRDC had worked on to try to get beyond the, test and chase approach. So included also in my written testimony, we, with our partners in the Filter First campaign, put together a cost estimate that shows the cost effectiveness of the Filter First approach. And that if you basically, by using this approach, we are able to save, it's only about 1/3 of what it costs to implement what we call test and chase approach, where you really do that comprehensive testing. Then you've spent the money on the testing, and it isn't just that, right? After you find lead in the drinking water, you have to do something about it. So the question is, what are you going to do, and how much is that going to cost versus just accepting the fact that the lead is there and going ahead and investing in the filters. And what we found is that for the year one, it is estimated to be about 1/3 of what it costs to implement more of a test and chase approach. And over a 10-year period, and again, the cost estimate was done in 2019, so we all know some things have changed out there in the world about supply chains and that type of thing. And so where we are now is that Filter First was estimated to cost about $80 million over a 10-year period, whereas the test and chase would be about $500 million. So again, I think for all of the reasons that have been stated, as well as the fact that this is the most cost-effective way to actually put a barrier between the lead and our kids in schools and child care centers, we urge you to support these three bills and appreciate your leadership. Also want to thank Representative Vanderwall. He isn't exaggerating in terms of the amount of work that has gone into this over the 3 years, and to the other two sponsors of the legislation, Representative Neely and Representative Puri, for their work to move this forward.
Thank you for your testimony. Do we have any other further questions? Seeing none, thank you so much. I'm not sure if she's back, but I'm going to circle back again for Abby Dumas one more time. Okay. We have some special guests joining us for committee today that I want to recognize. Taylor McKenzie, a science teacher at Everett High School, located here in Lansing that was mentioned before, has brought her students to watch the legislative process and support the students in their advocacy of these bills. Colleagues, please give them a warm welcome if you see them after today. And yes, a round of applause is due. Welcome to our Health Policy Committee, and thank you for joining us. Thank you, everyone, for your testimony and support of these bills. My intention is to bring these bills up for a vote next week in Health Policy Committee, and I've got some cards to read in here a second. So we've got Rhonda Grant representing Blue Conduit, Yusuf Rabi for the Michigan Nurses Association supporting, Sean McBurty from Clean Water Action, Paige Fultz from Lara, Frank Waters from Michigan Primary Care Association, Norm Hess from Michigan Association for Local Public Health, Amy Zagman, Michigan Council for Maternal and Child Health, Colin Ford, Michigan Chapter of the American Academy of Pediatrics, Rachel Richards, Michigan League for Public Policy, Jennifer McCoy, Policy Director for TIP of the Watershed Council, Mike Campagnoni for Michigan section of the American Waterworks Association, Charlotte Jameson from Michigan Environmental Council, Logan Vorse from Michigan League of Conservation Voters, Malcolm Pulley, students, he is a student, thank you, Zoe Pittman, possibly Morgan Wickasant. I'm sorry if I'm not pronouncing that right, trying to read these signatures. Janice Lodice, Liliana English, Monia Lodice, Mia Burton, Dynasty Porter, Travis Boskell from Department of Environmental, Great Lakes and Energy, and Marissa Kovach on behalf of the American Civil Liberties Union of Michigan. And then Representative Farhat moves to excuse Vice Chair Whitsett. There being no objection, the motion prevailed by unanimous consent. There being no further business before the committee will stand adjourned.